We know your pet is more than just an animal, they're family. At Safari Veterinary Care Centers, we're here to provide compassionate care, advanced medicine, and the support you and your pet deserve. At Safari, we believe in more than just veterinary care. We believe in building lifelong relationships with pets and their owners. Bladder stones, or uroliths, are mineral formations in a dog's bladder that can cause pain, difficulty urinating, and serious infections. If left untreated, they may lead to urinary blockages, which can be life-threatening. Today, we take you inside the operating room as Dr. Garner and the expert team at Safari Veterinary Care Centers perform a bladder stone removal surgery using ultrasound guidance for precise stone extraction, ultrasound diagnosis, and anesthesia. Before surgery, an ultrasound scan is performed to locate the bladder stones and assess their size, number, and position. This advanced imaging allows the surgical team to plan the procedure with precision, minimizing complications. To ensure a pain-free and safe procedure, the dog is placed under general anesthesia. Our veterinary team closely monitors heart rate, oxygen levels, and breathing throughout the surgery to maintain the dog's stability. Surgical site preparation. The dog is carefully positioned on the surgical table, allowing optimal access to the bladder for a safe and efficient procedure. Next, the surgical site is shaved, cleaned, and sterilized to prevent infection. The area is then draped with sterile surgical cloths to maintain a clean operating field, making the incision and accessing the bladder. Once the surgical field is fully prepped, Dr. Garner makes a precise incision in the lower abdomen, carefully cutting through the skin and muscle layers to expose the bladder. Surgical retractors are used to hold back surrounding tissues, providing a clear view of the bladder while protecting nearby organs. Removing the bladder stones. Dr. Garner carefully opens the bladder using a specialized surgical technique called a cystotomy. This step requires precision and delicate handling to avoid excessive bleeding or damage to the bladder wall. With the bladder exposed, the stones are carefully removed one by one using sterile surgical forceps. The bladder is then flushed with sterile saline to ensure all remaining small stones or debris are completely cleared. To confirm that no stones remain, Dr. Garner inspects the bladder manually and may use ultrasound guidance to ensure a complete removal. This step helps prevent recurrence and complications. Closing the bladder and suturing the incision. With all stones removed, the bladder is sutured in multiple layers to restore its integrity and prevent leaks. A strong closure is crucial for proper healing and function. Dr. Garner then closes the abdominal incision in multiple layers, ensuring the muscles, subcutaneous tissue, and skin heal correctly. The final layer of skin sutures helps protect against infections and promotes faster recovery. Pain management and postoperative fluids, antibiotics, and medications are administered to aid recovery and prevent infections. Most dogs begin to wake up within a few hours, and a soft diet and restricted activity are recommended for the next 10 to 14 days to allow proper healing. With proper care and monitoring, dogs recover well and return to a healthy, pain-free life. If your pet is experiencing frequent urinary accidents, straining to urinate, or signs of discomfort, they might have bladder stones. Early diagnosis and removal can prevent serious complications. Visit SafariVet.com to schedule a consultation with Dr. Garner and our expert team. Don't forget to like, share, and subscribe for more veterinary surgery videos.